Alright, so we're back. We've got the leads, electrodes hooked up to a real patient, and so now we'll show you actually how to acquire one. In the interim, we discovered too it's probably easier to put the electrodes on and then snap the wires on rather than have that tangled mess with the electrodes stuck to the wires while you're trying to put them on there. But you notice this is on a real patient and I still don't have an EKG tracing here. The critical piece here is to press lead. Remember, this is a 12 lead EKG. Doesn't matter which lead you look at, but you have to press lead at least once. So there's lead 1. So remember there's 12 leads that we can look at. There's 2, 3, AVR, AVL, AVF, V1, V2, V3, V4, 5, 6. Check. And then we're all the way back again. Okay. So remember, STEMIs, if you know what you're looking for, we can't diagnose that, but 2, 3, and AVF is where you would pick up the STEMI. So I'll just throw it on 2 just because that's one that I oftentimes look at. So your patient, this is going to acquire an EKG. It's going to require 10 seconds of calm in your patient. They have to lie still, not be tense, not move around, anything like that. It is pretty stable because I'm moving around a little bit here and it's actually given a pretty good tracing. But in order to acquire the EKG, I'm going to go back to 12 lead. Actually, it probably still was in 12 lead. We had it shut off during the little break there. It went back to 60-year-old male. It defaulted back to that. If you remember, I had it set on a 51-year-old male. But this is the screen that we were looking at when we paused, and you see this acquire button over here. So have your patient lie really still, relax, try to breathe normal, don't move around, hit the acquire button, and it takes 10 seconds. You see the paper coming out on the top there. It uses up quite a bit of paper. Here's our 12 lead EKG and the interpretive data with it. So if you tear it and lay it like that, you should be able to screenshot it with your phone and send it to the nurses. When we were playing around here during the break, we had a paper misfeed, and so we loaded the paper back in. We put this little tail up on the top here, pulled one sheet out like you do a lot of times with that continuous feed paper. So if you needed to go back in and print another one, if you go into patient info and patient records, there's all the EKGs that we've done just playing around. If you hit print all, it'll store up to 40 of them. If you hit print all, it's going to print all 40 of them, and you don't want to do that. That's a lot of paper. But if you want to just print the one that you just did, maybe you don't like that last one, but you want to print the one down below. Use these keys on the top here. Select the one you want and hit print record, and it'll print it out. So maybe it got destroyed, maybe it misfed, whatever the case may be. Okay, so that's how you would do that. Transmit is still not an option for us. These things do have Bluetooth, and the problem is that it needs to Bluetooth to a phone instead of all of our phones. So we don't have a phone on the rig, and so that's a stumbling point right now. But that's how to acquire 12 lead EKG. Just remember that that has to be in your scope of practice, either your floor skill or optional module, in order to acquire and transmit via cell phone the EKG.